Hello, everyone. Welcome back to Everyday English Chats.
Hi, friends. It's so nice to be here with you today.
Today, we are going to the doctor's office.
Yes, the doctor. Sometimes we need to see a doctor.
That's right. When we don't feel well, we go to the doctor.
And today, we will practice English for the doctor's office.
Don't worry, it's simple English. We will go slowly.
Yes, this is important English. You might need it someday.
Exactly. So let's practice together.
Okay, let's start. I'm not feeling well today.
Oh no, what's wrong?
I have a headache and my throat hurts.
That doesn't sound good. How long have you felt like this?
Since yesterday morning, it's getting worse.
You should see a doctor.
I know. I think I will. Can you come with me?
Of course. I'll help you. Let's go to the clinic.
Thank you. I feel nervous about speaking English at the doctor.
Don't worry. I'll be there with you. It will be okay.
Okay, let's go.
We are walking to the clinic now.
My head really hurts.
I know. Just a few more minutes. We're almost there.
Okay, I can see the clinic. There it is.
Yes, let's go inside.
I'm opening the door now.
Good. Look, there's the reception desk.
Should I go there?
Yes, the receptionist will help you.
Okay, here I go.
Hello? Hello, good morning. How can I help you?
I don't feel well. I need to see a doctor, please.
I'm sorry to hear that. Do you have an appointment?
No, I don't have an appointment.
That's okay. We can fit you in. What's your name?
My name is Sarah Kim.
Thank you, Sarah. Can you spell your last name for me?
Yes, K-I-M.
Perfect. And what's your date of birth?
March 15th, 1995.
Thank you. And your phone number?
It's 555-234-6789.
Great. Now, what are your symptoms today?
I have a headache and my throat hurts.
I see. Any fever?
I'm not sure. Maybe. I feel hot.
Okay. Please have a seat. The doctor will see you soon.
How long will I wait?
About 15 to 20 minutes.
Okay. Thank you.
You're welcome. Here's a form. Please fill it out while you wait.
Okay. Thank you.
You did great. That wasn't so hard, right?
No, it was easier than I thought. The receptionist was very nice.
Yes, most medical staff are very kind and patient.
That's good. Now I need to fill out this form.
Let me help you. What does it ask?
Name, address, phone number, date of birth.
Those are easy. You already know all that information.
Yes. Oh, it asks about allergies.
Do you have any allergies?
Yes, I'm allergic to penicillin.
Okay, write that down. It's very important.
I will. What else? Oh, current medications.
Are you taking any medicine right now?
No, nothing.
Then write none.
Okay, done. The form is complete.
Good job. Now we just wait.
I hope the doctor calls me soon. My head really hurts.
I know. Try to relax. Here, have some water.
Thank you. Oh, I hear my name. Sarah Kim.
That's you. Go ahead. I'll wait here.
Okay. Wish me luck.
You'll do great. Just speak slowly and clearly.
I will. Here I go.
Hello, Sarah. Please come with me.
Okay. Thank you.
We'll check your vitals first. Please sit here.
Okay.
I'm going to take your temperature.
All right.
Please open your mouth under your tongue.
Mm-hmm.
Okay, hold still. This will just take a moment. All done. You have a slight fever, 38.2 degrees. Is that bad? It's a low fever. Not too serious, but the doctor will check. Okay. Now I'll take your blood pressure. Please roll up your sleeve. Like this? Perfect. Relax your arm. Okay. You might feel some pressure, but it won't hurt. All right, all done. Your blood pressure is normal. That's good. Yes, now the doctor will see you. Please wait in room 3. Room 3. Okay, thank you. You're welcome. The doctor will be right with you. I'm hoping the doctor comes soon. The doctor came nicely, but she had a slight fever. Hello? May I come in? Yes, please come in. Hello, Sarah. I'm Dr. Johnson. Nice to meet you. Nice to meet you too. So, I see you're not feeling well today. Tell me what's wrong. I have a bad headache and my throat hurts. When did this start? Yesterday morning. I see. Any other symptoms? Cough? Runny nose? A little cough and I feel tired. Okay. And the nurse said you have a slight fever. Yes, she said 38.2. Right. Let me examine you. First, I'll check your throat. Okay. Please open your mouth wide and say ah. Ah. Good. Yes, your throat is quite red and swollen. Is it serious? Not too serious. It looks like a throat infection. What should I do? I'll prescribe some medicine, and you need to rest. Okay, what kind of medicine? Antibiotics to fight the infection. But first, are you allergic to any medication? Yes, penicillin. Good that you told me. I'll prescribe a different antibiotic. Thank you. Take it twice a day, morning and evening, with food. Twice a day with food. Okay. And drink plenty of water. Rest as much as you can. How long until I feel better? You should feel better in 2 or 3 days. And my headache? You can take paracetamol for the headache and fever. Paracetamol. Okay. Yes, every 6 hours if needed. Don't take more than 4 times a day. I understand. Every 6 hours, maximum 4 times. Exactly. Any questions? Can I go to work? I recommend rest for 2 days. Stay home if you can. Okay, I will. Good. If you don't feel better in 3 days, come back to see me. Okay, I will. Thank you, doctor. You're welcome. Take care of yourself. Here's your prescription. Thank you so much. Feel better soon, Sarah. Thank you. How did it go? It went well. The doctor was very kind. What did she say? I have a throat infection. She gave me antibiotics. Good. You'll feel better soon. I hope so. I need to get this prescription at the pharmacy. Let's go. There's a pharmacy across the street. Okay, let's go. You were so brave today. Thank you. It wasn't as scary as I thought. See? Speaking English at the doctor is not so hard. No, everyone was patient and helpful. Yes, medical professionals understand that English might be difficult. That's true. They speak slowly and clearly. And they ask simple questions. Yes, like, what's wrong and when did this start? Exactly. Very basic English. I'm glad I know these phrases now. Me too. This is important survival English. Yes, everyone needs to see a doctor sometimes. So friends, let's review the important phrases. Yes, first, I don't feel well. That's how you start. I don't feel well. Then you describe your symptoms. I have a headache, or my throat hurts. I have a fever, or I have a cough. Simple body parts in simple verbs. The doctor will ask, when did this start? You answer, yesterday, or 2 days ago. Easy, and they ask about allergies. Very important. Are you allergic to anything? Answer honestly. Yes, I'm allergic to penicillin. Or no, I have no allergies. The doctor will examine you and give advice. Listen carefully. Ask questions if you don't understand. Can you repeat that, please? Can you speak more slowly? Don't be shy. Your health is important. Exactly. Doctors want to help you. So speak up. Ask questions. And always bring your prescription to the pharmacy. Yes, don't forget your medicine. Okay, friends, that's our doctor visit conversation today. We hope this helps you feel more confident. Going to the doctor in English is not scary. Just use simple phrases and speak clearly. Practice these sentences at home. Say them out loud, again and again. I don't feel well. I have a headache. My throat hurts. When can I take this medicine? Simple, but very useful.
Remember, doctors are there to help you. Don't be afraid to speak English. They will understand. They are patient. Thank you for listening today. We hope you stay healthy. But if you need a doctor, you're ready now. See you in the next conversation. Goodbye, and take care of yourself. Goodbye, everyone. Stay well.